Madam Chair, please.
Was that a yes?
Yes, please.
Okay, we got 2 minutes. Oh, good thing we waited for the warden.
The live stream is all set whenever you're ready.
Thank you.
Aren't we all well behaved?
Yes.
Any good politician should know when they're being recorded.
Okay, it is 9 o'clock. I'll call the meeting to order, and I will share that Chair Mackey is sending his regrets, so I will be chairing the meeting. So welcome to the Long-Term Care Committee of Management meeting for March the 12th, 2024. I will ask if anyone has a declaration of interest. Seeing none, if one should arise during the meeting, you may declare it then. We do not have any delegations, so we'll move right into the reports. And the first one is LTCR CM 0424. It is the Long-Term Care Director's update from January 1st to February 29th of this year. I need a mover and seconder to put that on the floor. And I'll take Councillor Nielsen and Councillor Hutchinson. Jen?
Great, thank you, Madam Chair. And I will comment in my report, but before I move my notes in front of my screen and I can't see everyone, we do have a new face around the Zoom room today. So I just wanted to introduce Tolleen Parkin, who is our new Executive Director at Lee Manor. She comes to us from the Director of Care role. And maybe I'll skip this part in the director's update, but has a number of years of experience working as executive director in municipality in a municipal long-term care environment, as well as experience working with the LHIN and all sorts of other knowledge and expertise that she brings to the table. And so we're pleased to have her join our team.
Welcome, Tolleen.
All right, so the director's update, as you know, never a dull moment in long-term care land. So this summary provides an overview of ministry announcements, a number of updates and initiatives around health human resources recruitment, and I also wanted to highlight the welcome of Tolleen to this role. And so getting into the ministry updates, I'm not going to read through the entire report, but I'm going to highlight just some points of interest and important things to note. So Minister Cho did release an update on January 15th, introducing a new 10-person long-term care investigations unit. This unit is designated as provincial offences officers under the Provincial Offences Act. And it's now active and working in the sector and is going to investigate allegations under the Fixing Long-Term Care Act, such as failing to protect a resident from abuse or neglect, repeated or ongoing non-compliance, failing to comply with ministry inspectors' orders, suppressing or falsifying mandatory reports, and negligence of corporate directors. So it's notable because this is a new initiative, and we're still learning exactly what it's all about and how it will work. But my understanding is that it's to focus on the bad actors that are continuously not following the act and need some additional encouragement to do so. Ontario Health West, in the beginning of the year, announced a restructure, and they've restructured to align with their focused deliverables, which are around capacity, access, and flow, clinical programs, health equity and system transformation, performance, accountability, and funding allocation. I don't believe many, if any, of our contacts and colleagues at the OH West changed. Their portfolios just were adjusted. And then another item just of note is on February 9th, the ministry released proposed amendments to Ontario Regulations 246/22 under the Act. And the one that I just want to draw your attention to is the staffing qualifications for some roles are being adjusted. And one of them is the administrator role. And the proposed changes are suggesting that the 100-hour training, professional training around long-term care administrator, executive director, be removed from the requirements. And staff and Advantage Ontario are advocating against that. It is a very complex industry that we're in, and being the administrator or the executive director is like being as the CEO of a company, and it's very complex. And we really believe that the 100 hours of special education really help prepare someone to do that position. We're supportive of the other changes in broadening the type of degree or education that you need, but are advocating against the removal of the 100 hours. The other changes are really broadening the requirements for people to be able to work in long-term care in a very sensible way. So therapy services, restorative care, volunteer program. It was modernizing the language, essentially. The programs that were referenced in the Act don't really exist in the way that they are referenced, so it was broadening that. And then they sent out a memo reminding us of our obligations around quality improvement, and so there were no concerns there. We meet all of the required action items. And just before I move out of this section, I wanted to just give a verbal update from our last meeting about the Till Death Do Us Part Act and bill that was proposed. It was correspondence that we discussed at our last meeting. It was presented as for information with some discussion around whether or not committee wished to do something more than receive it for information. And I was asked to go back and just look into things a little bit more. Staff's recommendation is to continue to receive it for information. While we are very supportive of the premise and the premise of keeping spouses together in long-term care, the Act itself, some of the language in the Act is a bit problematic in aligning with the other admission language and legislative language that goes around crisis lists and transitions. So it's a bigger project. There's more work to be done on that, and Advantage is advocating for that as well. And I did want to just reassure committee that in our homes, we work really hard to reunite partners who wish to be in the same room together. And there's lots of things that we can do to try to support that by, other residents might make moves. We may get them to the same home area, so they're dining together. Then when a room comes available, they can share a room. So it's something that our teams spend a lot of time focusing on. So I just wanted to circle back on that. Moving on to infection prevention and control, wanted to update committee. It's an operational thing, but it's something that was a bit of a big deal in modernizing our dress code policy. And we had 3 separate policies that all spoke to kind of different parts. And so those were combined and really updating with more modern language. Apparently culottes aren't a thing anymore, but modernizing the language and having a focus on infection prevention and control. It was a busy beginning of the year in finance announcements. So there was announcements. We had applied for local priority funding, and there was broad announcements about local priority funding investments. And the investments that we've received are towards the purchase of bladder scanners and intravenous training, which are supporting the unnecessary transfers to emergency rooms, and intravenous training also supports our homes and our teams in having the skill level to be able to support some of our residents that may need IV therapy in the home instead of needing to go into hospital. We also received notification for the approval of the PSW placement stipend incentive. So there's a number of incentives that have come out around health human resources. And whenever possible, we're taking advantage of those opportunities. And there are a number of them. Our partners in human resources are supporting us in being able to manage these initiatives. So we're working on the PSW placement stipend. There were updated guidelines for the funding initiative for current students and recent graduates who commit to working in long-term care for a year. So we're working on that. And then the final announcement was around the direct care hours. And so if you recall, during budget discussions, there was a range that we could expect. And the ministry has just let us know what that amount will be for March, not beyond that. So we'll have to stay tuned for more of those discussions. Staff and training updates. Again, I'm pleased to welcome Tolleen Parkin to the team. I wanted to highlight that our 3 homes have supported 58 clinical student placements and onboarded 56 Color It coaches since October 2023. And this is part of the PrEP LTC initiative, the PrEP LTC program, where we've received funding to provide some professional development for our nursing staff, so PSWs, RPNs, and RNs who wish to be preceptors. And in our case, we call them Color It coaches. And so there's some funding to support them in education and funding to backfill them when they're being a preceptor or a coach for a student. So it improves the experience for our students, and it's improving the experience for our team members who aren't trying to educate, train, have someone shadow them, all while they're still trying to do their full tasks kind of at the side of their job. So it's proving to be a huge success. And the 56 Color It coaches, we did a call for expression of interest for people to put their hand up to say they're interested. And that's a huge number. So we're really pleased with that many people being interested in being a part of this program. We have 3 PSW champions who are participating in the Be Epic virtual reality training that was developed by Western University and the Sam Katz Community Health and Aging Research Unit. It's a 2-day training. It's fully funded, and it's designed to enhance PSW skills in person-centered communication and equip them to address challenges associated with dementia and delirium. So that's exciting. We're waiting to hear how that goes. And Lee Manor is participating in Georgian College's community integration through co-op program. And these students are required to participate in 3 separate unpaid field placements to develop critical employability skills. And the dietary department at Lee Manor will be the first department supporting this program. In recovery and wellness, this continues to be an important item that we keep on our standing agenda items and for our meetings, and something that is the focus of our decisions as we make changes and make commitments. And I just wanted to highlight that we are focused on diversity, equity, diversity, inclusion, and belonging. And one of the initiatives that we've done so far is to share the diversity and inclusion calendars that were created by the Ontario CLRI and the RIA. Research in Institute of Aging, and the CLRI is, I'll have to come back to it. Center for Learning, Research and Innovation. Accreditation, there's lots of work going on that you can see listed here in our accreditation update as we prepare for the survey at the end of May. And I wanted to just bring your attention to the annual report that is attached as attachment A to be able to see the full report. This report is a culmination of the successes and projects and initiatives that we have undertaken in 2023. And I hope that nothing is a surprise to you. Everything that is in there we have reported in our Committee of Management meetings over the year. But I hope you take a moment to have a look at it, and I hope you feel the level of pride that I do when you read through it. We often finish an initiative or a project and move on to the next thing or the next small fire that's burning, and we don't often take time to reflect on the amazing work that's been done. And this is a great report that highlights all of the exciting work that has happened in 2023. And finally, in partnerships, I wanted to highlight that Advantage Ontario held a 3-part webinar series focused on redevelopment. And Rockwood Terrace, Karen Kraus and I and Andrew from Collier's Project Leaders and Deborah from KZN Architect presented a session called Rockwood Terrace, Revitalizing Our Home for Person-Centered Care. And it went really well, and it was a great partnership presentation, and it was really well received, and it was exciting to be a part of. And that is a summary of the report, and happy to answer any questions if there are any.
Thanks, Jen. Are there questions or comments for Jen and the report? Warden Millen.
Thank you, Madam Chair. Morning, everyone. And Jen, a really good report as always. Just a question about the long-term care investigations unit. And I'll preface my question with saying that I don't anticipate seeing these people at all in our homes, just because of the level of professionalism we have. But I guess my question is, I don't understand the rationale. I mean, the rules are the rules, and you're either following them or you're not. And is the government suggesting that by putting this thing in place, that there are people that haven't been following the rules consistently, and now they're going to do the nuclear option and bring these guys in, or these folks? I mean, I don't understand the rationale here. Can you help me out a little bit, please?
Possibly not in terms of the rationale. But what I can say is, so I think you're right. I think that there are some bad actors. That's kind of the language, the words that we hear. So that the current compliance process just doesn't seem to be enough to affect change. I do want to say, though, at the end of February, I had a chance to attend Lobby Day as a board member with Advantage Ontario. And we got to meet with Minister Cho. And we talked about a number of things, put in some plugs about capital development top-up funding being important, direct care hours funding, but also talked about inspection, compliance and inspection. And I had the chance to bring up the fact that there's a missed opportunity with the current process for inspections, and that inspectors absolutely see and identify the things that need to be fixed, but they also get to see best practice, excellent problem solving, and good work across the whole province. They have this bird's eye view, and the missed opportunity is not using that to incentivize quality and leading practice, as opposed to threat and, well, as you called it, the nuclear approach. So as opposed that, my grandma used to say, you catch more flies with honey. And so I had a chance to say that, and he was very interested in that. I know we've said this a number of times over the year, but he's a new minister for us in long-term care, and his staff were there and were interested. And I sent some follow-up information that they responded to immediately. So hopefully there's some appetite, and that's something Advantage is doing, is to say we believe in inspection and compliance. We need to be held accountable, but we need a method to incentivize quality and to spread leading practice and quality practice. So that doesn't answer your question, but it is the diplomatic response. So I hope we don't ever see them in our homes, but never say never, because things happen. And if they do, they come and we, work through that process. But my gut is that it's for those bad actors that just consistently don't make change.
Thank you, Jen. And I would suggest that over my number of years in politics, I've become somewhat adept at reading between the lines. So indeed, you have answered my question. Thank you very much.
Any other comments or questions for Jen? Okay, so Jen, yes, you are correct. There's a lot happening in those, 2 months, right? A lot of initiatives, and your annual report is excellent. And I know that's also extra work on top of the regular duties. And I'm always amazed to see the social activities and the interaction, and just can't believe that you can bring a little pony in and everybody is so pleased. I'm sure that brings back memories for a lot of people. So thank you and well done.
Thank you.
All right, all in favor of the director's report? That is carried. Moving on is LTCR CM 0524. This is the long-term care operational report from December 15th to February 14th. I need a mover and seconder to put this on the floor. And I have Councillor Keaveney and Councillor Carleton. And we'll start with Renata.
Thank you. Good morning. Through you, Madam Chair. CIHI has not released any new data since our last report. And the indicators that are in the report are reflective of improvements or that are better or than the provincial average for the last 2 quarters, as well as improvement projects or indicators that require improvement have not changed for the last 2 quarters, with only slight variations in the data. The teams in the homes continue to work on improvement initiatives, for example, falls prevention and pain management. Are there any questions about the data?
I don't see any, Renata, so you can continue on.
The resident and family experience surveys for 2023 were released in December. Overall, 93% of the residents and families were satisfied with the quality of care and would recommend the homes. Recommending the homes is a 3.5% increase over our last survey from last year. The words that people use to describe our homes are caring, friendly, comfortable, clean. They are satisfied with the environment and the quality of care and the quality of life we provide. And the areas for improvement are dining, our contracted services, and communication. The teams have started working on their quality improvement plans to address the areas for improvement, and they'll be reflected in our 24-25 operating plans. Are there any questions about the surveys?
Warden Millen.
Thank you, Madam Chair. Renata, the surveys, do we survey family members who had a resident in the home but no longer, like recently, as opposed to folks that have a resident there now? There might be, and I haven't had any, feedback from anyone about this, but a family that has a resident there may be a little bit hesitant to be too critical while the resident is still there. So once the resident has left, maybe they might be a little more forthcoming. So I'm just wondering, is there an opportunity to survey some people from that perspective?
These surveys are for the residents who are currently in the home. And there is an opportunity to for follow-up after residents have left the home. But currently, these surveys are only for people who are currently residing in the home.
Okay, thank you.
Okay.
No other questions? Jen?
Thanks through you, Madam Chair. I'll just add, Warden Milne, that we work through it with a third party to do the surveys, so they are anonymous. They don't get handed back in at the home. They're electronic, or they get mailed, compiled and mailed back to. I can't remember the name of the company right now, but so hopefully that helps. But we will take your comments back and look at opportunity to do kind of an after a follow-up survey of some sort. So thank you for that.
Thank you.
Okay, so Renata, that you're finished? Okay, thank you. So
Thank you.
next is Tolene with the compliance and outbreak section.
Good morning, committee and Madam Chair. Thank you very much. I'll be sharing the Ministry Compliance and Outbreaks report. And so just as a background reminder, the Ministry of Long-Term Care does conduct inspections in long-term care homes, and they're following up on critical incidents or complaints or conducting our regular annual review. All of their visits are unannounced, so we don't know they're coming. When they're on site, they potentially interview residents, families, and staff. They look at our processes. They follow a pretty structured inspection protocol for whatever the issue is that they're inspecting. And now they always do conduct an IPAC inspection or an infection prevention and control inspection whenever they're on site in a home. So during the period of this report, each of the 3 homes did have a visit from the ministry. So Grey Gables had an inspector on site for 2 days to review our infection prevention and control program. There was an area of noncompliance related to PPE usage at that time, and it was corrected during the course of the inspection itself. Just to note in the report today for Rockwood Terrace, we did include the public inspection report from November that I believe was actually reported at the committee management meeting last time. So that report was now available. It wasn't available at the time. So it is included in the report today. Additionally, Rockwood had inspectors on site this year for 4 days in February to follow up on a critical incident. They were, again, part of the process is to look at IPAC, and they were pleased with our infection program. And we are currently waiting for the report of the inspection to be made available, but we do anticipate there will be an area of noncompliance related to the Code Blue policy during that visit at Rockwood. Lee Manor had an inspector in the home for 4 days at the end of January this year. They were inspecting on critical incidents related to a fall as well as an outbreak. There were no areas of noncompliance associated with the outbreak inspection, but we did receive 2 written notifications related to following and reassessing the plan of care associated with the fall inspection. And any questions about the compliance before I move on to outbreaks?
I don't see any.
Okay, thank you. And so for outbreaks, each of the homes did experience an outbreak during the period of this report. And just again, we follow really detailed processes whenever we potentially think there might be something infectious going on. That includes surveillance, assessment, testing, isolation, talking to residents and families, and making sure communication is flowing, working with our public health partners around, does this look like an outbreak? Does it meet the criteria? That kind of thing. So during this period of time, Grey Gables did have a COVID-19 outbreak in early December. 3 residents were affected, and that outbreak lasted 9 days, which was really quick. The lowest amount of time you can declare an outbreak over for COVID is 7 days. So really well done, Grey Gables. Lee Manor experienced 2 outbreaks in this quarter. We did have a COVID outbreak in January that did affect 13 residents and did last 24 days, as well as a gastrointestinal outbreak in February affecting 11 residents for a duration of 16 days. The agent identified for that outbreak was norovirus, which can be highly infectious. And so, I really think the team did really well to contain that outbreak to one home area without more than 11 residents being affected. So I do think it demonstrates some really strong IPAC practices with the team. Rockwood Terrace had a respiratory outbreak in February with the agent identified as an influenza A, which did affect 6 residents and lasted 10 days. Just on the vein of infection control, we also want to just mention that last week the minister did change the masking mandate. I'm sure you've all heard about it. And while we certainly maintain a mask-friendly environment and staff will continue to wear masks based on a point-of-care risk assessment, universal masking was removed by the ministry in that communication. And I wanted to just share that in keeping with our Color It Your Way values of resident-centered care and collaboration, we, in a very quick way, because the ministry sent this change out and it was effective immediately. So in a very quick manner, we did consult with our residents, families, and staff in all 3 homes to get their feedback about the changes. We wanted to make sure it's in keeping with what they desire and what they feel is important. And certainly all 3 homes, the residents were thrilled, quite frankly, about removing the masks for staff and expressed comments about being so joyful about now being able to see our faces, which is so important for communication. So being able to actually see people's lips move and to be able to connect to what they're hearing was really important to them. And that was their expression during that consultation. So I just wanted to share that with everyone as well. So I think that sums up our outbreak piece, and happy to take any questions as well.
Thank you. Are there any questions or comments? None today. Thank you, Tolene.
Thank you.
Okay, so moving on, Karen, you're going to do occupancy and events.
Yes, thank you, Madam Chair. Good morning, everyone. As you can see by the report, there were lots of Christmas events and spirit during the remainder of December, including the very touching story of the 7-year-old who raised money to take Grandma out for dinner. Lee Manor recognized Black History Month, and I would encourage you to take a little look at Rockwood's 2023 1-second video if you haven't already done so. I would like to take a couple minutes to talk about occupancy. Every report, you see our occupancy numbers, including the move-ins and discharges. The goal every year is to reach at least 97% occupancy, because if we meet that threshold, we receive 100% of government funding. So that's pretty critical for us. I must say, in my career here at the county, this hasn't been an issue until last year. Rockwood Terrace got very close to that threshold. And there are several reasons why you would have empty bed days, we call them. Sometimes it's because we're in an outbreak and we're not allowed to admit to any outbreak areas. Sometimes we have chosen to refurbish the room, so we're taking some time to do some painting and strip and wax the floor. Sometimes it's when we go to someone that's on the waiting list, their information hasn't been updated, so there's a little delay waiting on that. So there are lots of reasons why we might have empty beds. Last year, though, we were right on the cusp, as I said, of 97%. And fortunately, when we reached out to the ministry to ask about this and applied their formula, we were okay, and the 97% goal was met. One of the processes, though, we can complete to help meet this goal is when we are in outbreak, have those days recognized when we're closed to admissions. So it's a little bit of paperwork, but not too much. We receive our report from our public health partners every time we're in an outbreak. So we submit that to the ministry, as well as a letter from Home and Community Support Services that identify that we indeed had residents on our waiting list during that time. And then we can receive credit for the bed days that were lost due to outbreak. So every home now is submitting those post-outbreak in an effort to capture those days as well. And I'd be happy to take any questions.
Thanks, Karen. Are there any questions? Looks good.
Thank you.
Okay, and next is Shannon with compliments and Color It stories.
Thank you, through you, Madam Chair. Good morning, everybody. I'm also going to be speaking on the topic of the health system partners and environmental, and then I'll finish with the Color It stories. All three homes have had inspections from our health system partners during the reporting period. Grey Gables had our annual fire inspection. Public Health was into Lee Manor and Grey Gables to conduct a routine inspection of the kitchen, which had no findings. And Rockwood Terrace also had an ESA inspection, which is the Electrical Safety Authority inspection, with no recommendations left. And then under the environmental, we report on our emergency preparedness. We have annual drills. For example, Code Black was practiced at Grey Gables, and we have monthly drills as in the Code Red that all three homes have completed. Also during this reporting period, Rockwood Terrace conducted a vulnerable occupancy fire drill, which included an evacuation of one home area with minimal staffing levels, and it was completed in 7.45 minutes, which is well within the time frame allowed. So great job, Rockwood Terrace. This report has some amazing Color It stories, and I know all of the homes have so many beautiful stories, especially around Christmas time, which was this reporting period, that continue to improve the residents' lives within long-term care. And sometimes we are able to update spaces within our homes that have great impact on the looks, but then you hear a story of how an updated space made a huge impact on a resident. So Lee Manor has one of these stories, and I'm just going to highlight and read. The family dining room at Lee Manor had become a multi-purpose space during the pandemic, where it was often used as a vaccination clinic or a meeting room. As visiting restrictions decreased, residents and families resumed its use for celebrations, including birthday parties and anniversary celebrations. With this came the recommendation for an update. So they wanted more seating, and they wanted more of a home-like environment. The room was updated with a new refrigerator, microwave, television, fireplace, and a little banquet table with chairs. These new pieces were also IPAC friendly, of course. The home started promoting the use of this room in its monthly newsletter and during both resident and family council meetings. Recently, the home received a unique booking request. A resident asked to use the room to host their monthly community book club. It was this resident's turn to host, and she needed a larger space than her bedroom. So in true Color It fashion, the home was quick to support her needs. The room was equipped with enough seating to support her guests. Staff assisted in purchasing coffee and tea for her to serve, and staff decorated the space by the resident's request. The family dining room allowed this resident to welcome friends, enjoy a warm beverage, and discuss their latest read, just as she would as if she was living in the community. The home is looking forward to discuss or supporting the future opportunities for this space. And that's the end of my report, if there's any questions.
Thank you, Shannon. Councillor Keaveney.
Chair Pattison, thank you. And I apologize. I wasn't quick enough to get my hand up when Karen gave her report. May I go back and ask Karen a question?
Absolutely.
Thank you very much. I appreciate that. Karen, I'm just wondering if we are at all concerned about measles. We're hearing a lot in the news about outbreaks, particularly in Quebec, but I'm wondering with our residents, do we check when they're admitted their record of inoculations and immunizations? And is this, I'm just wondering if this is anything at all that we need to be thinking about.
Thank you, Councillor Keaveney, but I'm going to suggest that Dana might be the best person to address that question.
And I'm happy to jump in. Thank you, Karen, and through you, Madam Chair. Councillor Keaveney, we are on it. We are keeping an eye on what the current surveillance data is sharing. In terms of, do we assess residents' vaccination status? Absolutely. In terms of the demographic that we look at, you know, our residents coming in, we absolutely ascertain what their status is, what their risks may be. We are actually thinking about in our next family newsletter to address measles as a topic of interest, because it's with our visitors coming in, family members, staff members, etc. So we are following the recommendation of the Chief Medical Officer of Health to enhance our surveillance, as well as to work with our teams for additional vaccination and promotion. But definitely keeping in touch with public health and taking their advice going forward. It is an evolving trend, and it's a bit scary. So I would encourage everybody and anyone listening to ensure this is my opportunity to assess your vaccine status, family members, and recognizing that throughout the pandemic, you know, what's the root cause? That throughout the pandemic, some of vaccinations have lapsed. So we encourage everyone to take a look, family members, talk about it. Easter's coming. Maybe it could be a little plug to talk about measles and how we can prevent it. So thank you.
Thanks, Dana. That covers it, Shirley. Councillor Keaveney.
Thank you very much, Chair Sue. Yes.
Okay. All right. Going back to Shannon, is there anything anyone wants to comment? Color It Stories or the environmental? No questions or comments. And I am just going to check with Jen. Have I missed any sections? Okay, that's good. All right, I'll call the question. All in favor of the operational report? That is carried. We have another report, LTCR-CM0624. This is the 2023 long-term care write-off of uncollectible accounts. I need a mover and seconder, and I'll take Warden Millen and Councillor Hutchinson. Marcus. There he is.
There we go. Thank you, Madam Chair. I'm going to walk the committee through our annual report for the write-off of uncollectible accounts with the homes. This is by far not going to be the most exciting report that comes to you guys today, as it's the annual report that is required for us to complete with the ministry, and that is for those accounts that have extended past their regular payments. We write it off at the end of the year. We then reapply them again to the following year, unless we actually deem that it is uncollectible. And then what we do is we send it to the ministry to collect 50% of the total write-off amount and that kind of stuff. So honestly, it's a cyclical report and process that we do every year for year end. So going right into it, starting with the executive summary. Balance owing from residents with no payment activity are written off at year-end accounting purposes, and staff continue to work on collections even after we've written them off. This report recommends $14,889 in arrears be written off for 2023 fiscal year. All available measures are used to collect monies due to Grey County on a timely basis. Accounts in arrears are reviewed and assistance is provided to residents and families to support receipt of payment whenever possible. the Ministry of Long-Term Care will reimburse Grey County for 50% of the uncollectible accounts. So there is the background and discussion to talk about, again, the process of like why we do this and that. But what I'd like to take you down to is the actual table. So what we can see with the multi-years, as you see, 2023 is a significantly lower amount than what it was in 2022 or even in 2021 as well. So we've seen quite a strong drop off as to how much does get dropped off. Again, with when we're talking about $14,000, we're not even we're talking about less than 0.25% of our overall revenues from residents in that. So what you can see is that 14,889 for 2023. You can also see that total amount recovered per year. So we actually recovered $29,694 this year, 2023 as well. That was again through the collective work of our office coordinators, still reaching out to the families and having those communications. And what happened with many of these cases anecdotally is that they weren't in a position that they were able to have the funds to pay us back, even as members have either passed or have moved to a different home in that. Well, we then after life changes have changed or circumstances have adjusted, they've come back to pay us in that. So even the one that was there was one in 2023 where that was a multi-year one that they then came back to make whole. So it's something that does happen. It's as much as we have to report this every year to say we need to write off these accounts, we do see that there is still constant year-over-year work to collect and to make things right. We're not seeing anything of ill intent really on our side with our residents. Going down a bit further, Grey Gables, you can see that. So of the $14,889, Grey Gables holds $7,250, which is made up of four accounts. Lee Manor has $4,784, which is of 3 accounts, and Rockwood has 1 account for $2,885. Now, the trend that we've noticed, so we've used the next paragraph to talk about the trends as to what makes up this year's batch. Last year, we were having difficulties with PGT specifically of just the long delays and being able to start receiving payments. What we've seen this year has been quite a bit of a shift as to what it is, and what it's been is that it's been residents who have passed with minimal funds remaining in their estates to settle debt. So a lot of our write-offs or write-offs that are in this one are the estate of so-and-so and that kind of stuff. So it's ones where they just don't have all the funds to settle all matters that exist with their life in that. So Grey County staff have worked with family members and power of attorneys with strategies to settle the accounts as much as possible. There is an increased amount of residents moving in who are also facing financial hardship and require increased financial advisory support, resulting in an increased workload in the office coordinator. So we do see more and more coming saying that we need to figure out more of their life, helping them with relief options or finding other or organizing exactly how they're paying all of their debts or bills, etc. So moving right down to the financial and resource implication, the uncollectible amount of $14,889 will be submitted to the ministry with approval of this report, which will provide a $7,445 eligible ministry reimbursement. We require that the accounts be written off, be completed in the calendar year that the arrears relate to. Our current budget practice, again, is to not budget any amounts being written off, as the amount historically have remained under 0.25% of our resident accommodation revenue across the 3 homes. So we are still talking about very small numbers with this, which is very, very commendable against what we see with a lot of other bigger organizations in that. Additionally, it has been a trend in the recent years that while we write off various accounts due to the annual obligation of this report, they are settled in time with family members being resolved, as we have seen this year, which is going back to it. That is the report. There is there is some good news with it, again, like showing about the recovery and that. But I'm happy to answer any questions or if anyone's interested in any of our bad debt trending.
Thanks, Marcus. Are there any questions for Marcus? Okay, I don't see any. And it looks, or it appears that everyone's doing a great job trying to handle all these interactions with people and their families and everything, and trying to collect the debt. So well done. I do have one comment though, Marcus. You're the only one that doesn't have color it in your report. So you're going to have to come up with an idea on how to work that in there. So somehow. So, all right, all in favor of the long-term care write-off of uncollectible accounts? That is carried. Thank you. So item 6, correspondence, we do not have any. Item 7 is other business. Is there any other business? Seeing none, next meeting date will be sent out to us.
Through you, Madam Chair, the next meeting date is May 14th, again at 9 a.m.
That's May 14th at 9 a.m. for the next meeting. We have one motion left, and that is to adjourn at 9:49. I need a mover and seconder. And I'll take Councillor Nielsen and and Warden Millen. All in favor? That is carried. Thank you very much, everyone.
Take care all.
Thank you. Have a great day.
Yes.